I'm Chief Medical Officer of Anthem Blue Cross of California. And I think, Gavin and Jeanette have really done a nice job of summarizing and highlighting the utilities and impact of ADT data, right? It's one of those, I wouldn't say rare, but certainly not common, circumstances or scenarios where, in my opinion, patients' interest, providers' interest, provider groups' interest, hospitals' interest, and payers' interest are all aligned when it comes to ADT, right? And we may all have slightly different starting points, but the interest is all aligned, right? Because our members, our patients, they don't want to go to the ER unnecessarily. And as Jeanette was saying, be there for 8 or 12 hours or something that really doesn't require going to the ER, right? And similarly, I don't know of anyone that willingly, wants to go into the hospital, right? So I think, the data that Gavin and Jeanette have shared with us clearly illustrated the impact of ADT, right? But the interest is so aligned across all spectrum, right? The entire spectrum. And that's what's really exciting from, our perspective, right? Because it's not one of the situations where payers may be at odds with providers or vice versa. And in this case, truly, everyone is aligned and we all work together. And ultimately, it benefits, our members and our patients, right? And that's really the bottom line, as Jeanette was talking about. We found that ADT data has really been helpful for us when it comes to, inpatient as well as emergency room, right? Management and care coordination, right? It can help us identify patients that are admitted or discharged, and frequently the so-called frequent flyers that Jeanette referred to, right? Or members that have complex medical conditions that facilitate, improves our communication, right, between our care teams, and it really helps us to coordinate, care transitions, right? That goes without saying, and just as importantly, it allows from the health plan perspective in terms of our trending and monitoring of data that we're able to monitor and manage the patient flow.